Hello, everyone. Happy Tuesday. We've been doing a lot of gut health inside the Wild Side community group, as well as the inner circle, as well as I've been posting about it all across my social media feeds. Make sure to follow me at Brianne Callanan. So what I thought I would go ahead and do today, because we talk a lot about gut health, we talk about the GI map, I thought I would share my screen with you and just walk you through really briefly my results from my own GI map testing, kind of give you a background about what the test looks at. And then it's really cool to see what you can do with these results and how they impact so many different things. From skin conditions to anxiety, depression, to autoimmunity, to, of course, like feeling bloated, recent infections, recurrent infections, abdominal pain, bloating, food sensitivities, autoimmune disease. I think I've already mentioned that one, but it all I've been finding stems back to the gut, and I absolutely love this test. And I thought I would go through it with you today, show you what came up on mine and kind of what this GI map tests for. So this is a DNA stool test. It's something that's available through a functional medicine practitioner, medical doctor, naturopathic doctor can order this for you. And essentially this test looks at DNA fragments of different pathogens, opportunistic bacteria, viruses, as well as overall gut health through a DNA sample that is taken from your stool. So essentially you just poop in a French fry container, you ship it off to the lab, they analyze it, and then we get the results and we can go through it together. So the first thing that this GI map looks at is pathogenic bacteria. So these are bacteria that are known to cause disease in humans, and these are the big ones. So C. difficile, Campylobacter, enterohemorrhagic E. coli, E. coli 0157, like Shigella. These are Salmonella. These are ones that you've heard of more commonly, and we know they cause issues for people. So that's the first part. Now, interestingly enough, I see a lot of these bacterial pathogens coming up, and for some reason, they're not being diagnosed with simple stool tests, right? And the really great thing about the DNA stool testing is it not only says like, yes, is it present? No, it's not present. It actually gives you a value so you can see, okay, how much is this present? And is this actually contributing to the clinical picture, or is it something that's just hanging out and it's not causing too much of the symptoms and we can kind of, support the body at eliminating itself? Does this absolutely have to be treated? So these are the big ones, the ones that are known to cause pathogens that are at the top. Then we have bacteria, we have parasitic pathogens, we have viral pathogens as well. So these are all the ones that are documented in the literature to cause symptoms for people. Now, there are other bacteria, parasites, worms, that are called opportunistic. We're going to skip over the H. pylori right now and move into the opportunistic and normal flora. So normal bacteria flora are great. You've all heard of like taking probiotics, taking prebiotics to support the probiotics, and we want a diverse, robust gut microflora. Yes, but there is the possibility of overdoing it. So that is why, I don't believe that every single person needs the exact same probiotic. And through testing, we can figure out what would be the best for you. Because if you see here, if you have a bifidobacterium overgrowth, or if you have a lactobacillus overgrowth, putting on a probiotic that contains those strains is probably not the best idea for you, and you would have no clue unless you tested. So I always say, like, it's important to listen to your story. I want to do your clinical history, but then at the same time, I want to test, not guess, because that's why I truly believe my patients see phenomenal results, because we get to the root cause of the problem. We have the labs and we say, okay, this is caused by XYZ. This is the game plan that we're going to come up with to eliminate it. This is how long it's going to take. This is what you can expect. What do you think? Risk, benefit, alternatives, and what if you did nothing, kind of game plan that we go through with you. H. pylori is a common bacteria that lives in the gut and can give rise to ulcers. Sometimes it's necessary to treat if you have symptoms, sometimes it's not, depending on what your clinical presentation are. But the nice thing, this tells you the virulence factors. So this is like how strong and mighty and smart this bacteria is to evade your immune system. So we can tell all of that. by this testing. So the typical treatment for H. pylori is called triple therapy. It's a combination of antibiotics, but if you have virulence factors that are very robust, you might want to also throw in some herbal therapy in there. In addition, at the very bottom of this test, it shows different antibiotic resistant strains that are present in the gut. So that'll help you best choose an antibiotic if you're going that route that will not be resistant due to the particular resistant virulence factors that that strain possesses, if that makes sense. Again, we went through the normal bacteria flora. We want to make sure that this is really robust, within healthy range, and a wide variety. And things that you can do to support a normal bacterial flora is, consume dark leafy greens, consume a variety of different foods, stress less. So the more stress hormones you have, the more catecholamines, norepinephrine, and epinephrine you have in your brain, that can actually help these gram-negative or negative bacteria, the bacteria you don't want in your gut, to flourish and thrive and become more virulent. So escaping your immune system even more. So the brain is connected to the gut through hormones, through nerve signaling, through the immune system. So keep that in mind. You can absolutely change the health of your gut by your mindset. So that's something you want to watch as well. Here we get into this Bacteroidetes firmicutes ratio that I often talk about. So these are just two subclasses of bacteria in your gut, and then all your other normal flora kind of resides within one of these two phylas of bacteria. Okay, so these are like the main the classes of bacteria. Now there is documented research that you want this ratio less than 1. And you want it less than 1 because we are noticing that if it's greater than 1, you are more likely to be obese and struggle with weight gain. Now, if this ratio is off and you're looking to lose weight, it's going to be an uphill battle for you. You have to get your gut health under control so that you can absorb your nutrients, so that you're not extracting more calories from food than you need to. So an elevated ratio has shown that, your friend and you eat the exact same meal, you have higher firmicutes, you're going to absorb more calories from that meal. So if you're looking to do weight loss, if you're looking to do the immune systems in your gut, if you're looking to do thyroid hormone, that's produced in your gut. If you're looking for mood, serotonin, that's in the gut. You've got to get this under control. And this is why I have started a treatment plan for me, because as you can see, my ratio is fine, which is great, but both of my firmicutes and bacteriocides are high. Now it's like, okay, we can dig a little deeper. Why are these ones high? Normal gut flora, these are all, higher end of range, but still within normal. What is causing these guys to be high? So then you can keep going and looking and deciding, okay, is it like a spore forming probiotic that would be better for me? Because I don't necessarily want to boost these phyla of microbiota because it's just going to make the situation worse. 30 grams of glutamine for 2 weeks has been shown to alter this ratio, which is really awesome that we have something so simple and easy to do to change this. But the thing is, you have to stick with it. Consistency is key. Other things that this shows is opportunistic bacteria. So these are bacteria that reside in the gut. They typically don't cause a problem, but if given the right conditions, if given the opportunity, they can flourish and grow too much. So I have a higher level of opportunistic bacterial growth, streptococcus and enterococcus. So that's interesting. All right, so we'll keep that in mind. And this is where it gets really fascinating. It's like, okay, well, why are these opportunistic bacteria growing? Do I need to change my diet? We know that a higher fat diet will alter this ratio negatively, increasing the amount of firmicutes you have. Something to keep in mind. Okay, stress can cause overgrowth, environmental toxins, lack of the robust immune system in your gut. So actually, when we scroll down here a little bit further and we look at, so I didn't have any yeast, didn't have any viruses, great. A little bit of a parasite present. This is something that is not treated conventionally, typically doesn't cause symptoms, doesn't cause problems, but given the right conditions, it may. So just because this doesn't cause symptoms and problems from the vast majority of people doesn't mean it's not negatively affecting you. So that's where, individualized medicine comes into play huge. Like, we don't want parasites or protozoa present in your body, because that could be triggering your immune system. Or it's like, okay, why is your immune system not fighting it? So not only do I have this parasite present that's higher, this is also, it came up on my kids, proper hand washing, making sure to clean your fruits and vegetables really well, drinking clean quality water, washing hands, washing hands, washing hands. We also did some antimicrobial therapy for this. But the thing is, okay, like we've got some overgrowth and we've got this parasite going on. Why is this? No worms, good. Okay, we'll talk about this in a second, but I want to get to why this might be happening. So as you can see here, secretory IgA, this is the immunoglobulin in your gut that is responsible for your immune system in your gut. Mine is actually low. So this is showing me, okay, the immune system in my gut needs support. So if I didn't know this and I just gave a whole bunch of antimicrobials, killed off, you're going to kill some of the good when you do that. You're going to kill the bad, but you're also going to kill the good a little bit. If I didn't support this immune system piece, realistically, this was going to all come back. So what I've been doing to support IgA is IntegraCell colostrum. That's been shown to boost IgA in the gut, as well as really focusing on cortisol management to promote a good, healthy immune system. And we've been doing some other things for immune support as well. Now, that is likely at the root cause of a lot of what's going on. In addition, the steatocrit here, this is high. So this is a marker of fats in the stool. So this is showing that there's a high percentage of fat in my stool, likely that I'm not breaking down fats. So I've also thrown in a digestive enzyme here. I'm making sure to do lifestyle changes. So eating in a state where I am calm, I'm resting and digesting, cleaning up the diet, making sure that it's like high quality fats that I'm eating, really slowing down, not having phones present, taking a digestive enzyme, and also doing intermittent fasting will also help balance this gut microflora out as well. So that is what I'm doing to support my IgA. There's no blood in the stool, so fetal occult blood is 0. Elastase is good. It could be higher, so elastase is like pancreatic function. How well is your body producing those enzymes to break down your food? It could be more ideal. So I am taking a digestive enzyme with pancreatic enzymes. It has oxbile in there to help break down this fat. It has beta-HCl. It's like a comprehensive, really great digestive enzyme. Beta-glucuronidase, this is an enzyme essentially that will cleave off the bond of estrogen, and instead of estrogen being eliminated after phase 2 detox through the bowels, it can be recirculating. So you really want to watch if your beta-glucuronidase is really high, because you're going to be increasing your risk of things like colon cancer and breast cancer, especially if you are seeing more of those quote-unquote harmful estrogen metabolites on Dutch testing. So often I will combine the GI map test with Dutch testing. That's a dried urine test for hormones, and kind of look at the overall picture for people, because if we can lower this beta-glucuronidase into a healthy level, especially in someone who has a risk of colon cancer and breast cancer, that's where I think naturopathic medicine, functional medicine really thrives, because we can prevent disease at that point. Calprotectin is a marker of inflammation in the gut. So mine is good. I've seen this level very high, and I've seen it come down significantly from doing like a gut healing protocol using things like aloe, mastigum, things that are nice and nourishing. Those soluble and insoluble fibers are really helpful. GI Revive is great for healing inflammation in the gut. So keep all those things in mind. Zonulin is something that I add on to this test. That is the marker of leaky gut. So this is very important in things like eczema, things like food sensitivities, allergies, etc. If you're suspecting leaky gut at all, you can use zonulin to test for that. And then, of course, doing things to heal the gut, glutamines and carnosine, removing those food triggers, removing the environmental toxins, removing anything that's going to be damaging the lining of your GI tract, your unique sensitivities, toxins, plastics, like really clean whole foods diet, plant-based, wide diversity, very, very important for you. Anti-gliadin IgA essentially is for gluten sensitivity. I often see this anti-gliadin IgA elevated with zonulin, but for me it was not elevated, but I make sure not to overdo gluten and dairy, because I know it doesn't make my body feel so great. And then these are the antibiotic resistant gene phenotypes. If you're deciding to use antibiotics, it's nice to see, okay, is there any resistant strains that are present, because then it can help you target your treatment even better. Now, back to the autoimmune potential triggers. So this is what I really like here. If someone has a family history or personal history of autoimmune disease is your body's misinterpreting its own tissues. So it's essentially attacking itself. And it's like, okay, what triggered that? And there's really new fascinating research that it's like, okay, has your body interacted with a bacteria, a parasite, a virus, a worm, something that has misplaced the sequence in the immune system, causing it to overreact to certain things where it shouldn't have? So literature does support that these bacterial infections are connected to potential autoimmune disease and could be an underlying trigger in those with a genetic susceptibility, with environmental toxins. Like, it's never one thing with autoimmune disease, but it could be the perfect storm. But if you can catch it early and you can clear these gut infections, that's where I think we can really prevent the onset of autoimmune disease, or at least support the progression throughout the disease history. So here we have everything was within normal range. The only one that was present but low enough, you have to watch the numbers here because it's to the power of 3 versus the power of 4. You'll get used to it once you see it more often, but it's this Klebsiella pneumonia. Now, in my book, don't look at my screen because it's crazy back there, Klebsiella pneumonia, and this is all included in here, but I wanted to show you that this can be seen in things like rheumatoid arthritis. So it's like, okay, I don't really have a family history of rheumatoid arthritis, but I still want to be like cautious of this, because you want to say, okay, like, is there a connection anywhere here? Are there things I need to be thinking of? What can these potential infections cause? And, you know, we see this a lot, like Epstein-Barr virus and multiple sclerosis, Lyme disease. Like, we know bacteria can cause autoimmune disease. So it's really important to identify it, test, don't guess, know, and clear it. So my program that I am on right now includes we're removing the triggers. So I know my food sensitivities. I've removed them. I'm eating very clean. I'm doing plant-based. Interestingly enough, so gut bacteria, if there's an overgrowth, especially gram-negative bacteria, they will feed off of folate. So folate is rich in foliage, so those dark leafy green vegetables. And I notice that I get gas and bloating more with those dark leafy greens, with those cruciferous vegetables, which might be gut related, might be something else, but I'm always curious. I'm like, I wonder if I'm feeding those gut bugs with all the folate I'm eating, and that's why I don't feel so good after those meals. So it'll be interesting. Here's where I'm going with this. It'll be interesting to see if my gut response to certain foods changes once these overgrowth of different bacteria and that parasite is gone. So I'm doing removing. So I'm removing the foods, removing the toxins, really cleaning it up, supporting my body with stress management, all that good stuff. And I am also replacing. So we know that my fats were not being properly digested, and my pancreatic function was like low normal. So I am supplementing with my digestive enzyme, which contains betaine HCl. If you have an elevated H. pylori, which I don't even have those results back yet, you want to make sure that you're supplementing with HCl appropriately, clearing that infection. So I have a herbal-based treatment that's designed specifically for what I'm dealing with, and that's going to help remove the dysbiosis. Then we're going to replace the key nutrients, so anything that I'm deficient in. So maybe I haven't had enough stomach acid for a long time to really absorb all the nutrients from my food. Maybe I'm not absorbing those fats as good as I want. If you're not digesting fats, vitamin A, E, D, and K will be an issue for you. So really, after you've removed these gut bugs, you've replaced your key nutrients, you want to replace healthy flora, optimize the gut flora with a vast, diverse gut, vast different dark leafy greens. That'll help promote a really healthy gut bacteria. And then what we're going to do is we're going to heal the gut with something like GI Revive that just contains a lot of different gut healing components L-glutamine, zinc carnosine, aloe, all of those insoluble, soluble fiber type things to heal the gut up, and then that should be good. So my symptoms were very much more bloating type symptoms, nothing majorly significant, a little bit of fatigue, but mostly bloating after meals. And I was just curious about what was going on. My son, on the other hand, was having a lot of loose stools after meals. We thought it was connected to gluten, and it turns his anti-gluten IgA was really elevated, and he had some different gut bug imbalances, and when it's one family member, it's often the whole family. So I tested myself at the same time. So our treatments are very similar. What we are doing is we're just going to do like an anti-parasitic treatment with him. It's a little bit more challenging with kids finding something that they'll actually take, because not all anti-parasitic stuff tastes good. So we're doing just like a straight black walnut for him. Then we're going to heal the gut with some GI Revive, and we'll go from there and see if we can modulate his calprotectin levels, which is the marker of inflammation, which was really high for him. So I'm really curious to see after a couple months with doing like removing the foods and gut healing, if we can lower his calprotectin significantly, because, you know, kids go all the time with, you know, loose stools, or, you know, it wasn't even something that was that big of a deal. But if I didn't do this test and I didn't see how high that fecal calprotectin was, it could have been significant enough to increase his risk of things like Crohn's, colitis, you know, that IBD, irritable bowel disease, IBS at the very least. So I'm glad that we did it. We caught it early. We're going to fix it. And he is completely down for treatment, because he really would like to have some bread back in his diet. So we'll see. I'll keep you posted on that. I hope this little overview was helpful for you. My book launches hopefully next week on Amazon, so I'll keep you posted about that. Make sure to grab it. It is just like jam-packed full of really awesome stuff, from hormones to gut, to autoimmunity, to all of like the latest research that I've been staying on top of. So I'm really excited to share it with you guys. And if you have any questions, please reach out. Let me know. My email is brianne@briannecallanan.com, or you can reach me through the Wild Side community. Make sure to join that. It's a free community. I've given you lots of information, so take it all in. And if you have any questions, let me know. But in the meantime, I'll let you absorb that, and we'll talk soon.